Hi, everyone. Good afternoon. My name is Heather Friends. I'm the Director of Healthy Childcare Colorado here at Qualistar, and I thank you for registering today with our webinar, What Guides Your Diabetes Care Consultation webinar. Healthy Childcare Colorado is a program of Qualistar, and we work to improve health and safety in childcare through training childcare providers, health consultants, and families. Again, I thank you for registering today. And please remember that your certificate of participation will be emailed to you after 10 business days. If you do not receive it, please feel free to email me at hfriends@qualistar.org. That's hfriends@qualistar.org. And my email will be on the last slide of this presentation as well. If you have any questions during our webinar, please type them into the chat box that you will see at the bottom left-hand side of your screen. And if you scroll down to select chat recipients, if you select all, that will help everyone in our webinar see your questions, and they may help others as well. So please select the all Dropbox button. I'm honored today to introduce Pam Nee and Leah Whitecoff. They are both school nurse consultants. And Pam is at Children's Hospital, and she's a diabetes resource nurse for the American Diabetes Association. And Leah is a diabetes educator for the Barbara Davis Center. So thank you for participating with us today, and I'm going to introduce both Leah and Pam.
Thank you, Heather, for the introduction. Both Pam and I want to say how excited we are to be able to present to you this program that we have with a website for diabetes care in the school and child care setting. And we both work with child care centers ourselves, so we speak from experience as well. Guides your diabetes care consultation? That's the question for today. And the objectives that we came up with were we wanted to explain a little bit about the Colorado Kids with Diabetes Care and Prevention Collaborative and the standards of care that have come from the collaborative. Also to review the www.coloradokidswithdiabetes.org website. We're going to go over some of the care plan templates that we have, and also discuss training, delegation, and documentation tools for unlicensed personnel. The Colorado Kids with Diabetes Care and Prevention Collaborative was started about 2005-2006. And this is a representative group including the Colorado Department of Education, the American Diabetes Association, the Department of Public Health, Barbara Davis Center. We include the local endocrinologists, and including Colorado Springs, and we also have many representatives, including Qualistar, that come to the meetings. It's very inclusive, and we do want to represent the children in our community. The collaborative started out when there were parent concerns going to the American Diabetes Association that their child's care was not being provided in the school setting, such as giving glucagon, eating insulin, and such things like that. The school nurses had concerns about the ratios. We needed clarification on the Nurse Practice Act regarding delegation of insulin, and there was an identified need for diabetes resource nurses to provide assistance in educating school nurses out there on and actually keeping up with technology as it has come about with diabetes. And there was also an identified need for standards of care. So that's a little bit about the history. From that, we developed standards of care for diabetes management in the school setting. And we use that very inclusive again to any kind of out-of-home setting. I mentioned, review and identify the standards of care that were basic to providing services outside of the home. The standards are used in conjunction with provider orders, and then the healthcare plans have been aligned with the standards. The standards address these topics: communication, blood glucose monitoring, hypo and hyperglycemia, with and without a pump, school exercise and attendance. We talk about CGMs, insulin management, pump management, the new thresholds of spin pump, and self-care management. So each of these are addressed. The purpose of the standards were to increase the school nurse and child care health consultants' awareness of what is standard and routine practice of type 1 diabetes management in the out-of-home setting. It is to be used by the school nurse or the child care health consultant in developing the individualized health plan and in providing care out of the home. And also as a reference for appropriate for parents and school administration, school staff, healthcare providers, what is appropriate in the out-of-home setting. As I mentioned, they're going to be used in conjunction with orders and the individualized health plans. The nurse will reference the standards of care in developing and completing the plan based on the orders. I want to make sure it's noted that at every step of the way, the healthcare provider has the opportunity, as well as the school nurse, to individualize and indicate exceptions to these standards as the student needs them. So one of the pieces of the communication, I'm certainly just going to highlight the standards as we go through. And one of the pieces that we wanted to highlight was that it's clearly indicated in the standards that school nurse has authorization to exchange health information with the provider in order to develop, update, and carry out the orders and the individualized health plan. So I think that can be a really useful tool when you're working with parents, that they understand that this is this reciprocity that is needed in keeping their child safe at school or out of the home. Monitoring blood glucose is discussed, and there are specific target ranges per age in there. Generally, you do get these from your healthcare provider, but if not, they are referenced there. Probably these are going to change for the 2015. This is going to be coming up 2015 will be our third edition of standards. And we're always looking at the American Diabetes Association and evidence-based research out there on the standards to use them. Hypoglycemia, like I said, is specifically mentioned. Some of the newer examples that have been added is that when you give, not to give insulin for carbohydrates given to treat low blood glucose, we want to make sure that was clear. So if a child is less than their target range and we give them fast-acting glucose or a complex carbohydrate after that, then we will not give insulin for those carbohydrates unless these were exemptions from the provider. Also, how to determine an insulin bolus for snacks following hypoglycemia discussed. When to give insulin at lunchtime following hypoglycemia. So it really tries to address each step as it goes along with the care in the school or child care setting. And at this point, I just want to say, if you at the end of this, both Pam and I have given our emails, and if you have some ideas of something specific that needs to would like addressed, just send us an email and we'll, we always bring these concerns up to the collaborative to update. So what's new in this is the second standards that have been come out, is that we're talking about, we gave some parameters for the younger child, the less than 5-year-old, what would be an appropriate fast-acting carbohydrate for them. And then also just severe symptoms. The endocrinologist wanted to make sure that blood glucose levels were checked if the meter was available, if a child is having seizures or unconscious, because it could be from other causes. It could actually be from a seizure disorder, or maybe they fell and hit their head, and that's why they're unconscious or something like that. So if available, check blood glucose levels. Hyperglycemia is addressed with no pump or pump, because they're a little bit different. Also, there's a table to when a child can have exercise or be in school. With no pump, check urine blood ketones if the glucose is greater than 300 milligrams twice in a row. That's the standard now. And when to go home is addressed, and when can a student have another dose of insulin. So a lot of very specific information for hyperglycemia. With a pump, then talking about using the pump calculator, make sure that is done. That's the most safest way to do it. What to do when the glucose level is greater than target range but less than 350. So a lot of very specific details are addressed, which will support the school nurse or health care consultant. Here's that table that I mentioned. So based on blood glucose levels, ketone levels, and what exercise is allowed, and can they stay in school to be safe. Continuous glucose monitors are discussed, and we really want to emphasize at this point that the FDA has not approved the CGMs to be used to treat glucose levels, that it has to be confirmed with a finger stick blood glucose level for treatment, and this is again for safety. And they're still not quite reading, CGMs read about 10 to 15 minutes based on about 10 older ranges of what the glucose level was than actually if you get it from a blood glucose level. It runs about 10 to 15 minutes behind. We talk about alarms being conservative so that the students' activities are not interrupted, and then they won't also get alarm fatigue. That's one of the concerns with having too many alarms set during the school day. We're working on a specific skills checklist for the continuous glucose monitor, and we'll show you where that is on the website in just a little bit. Insulin management is discussed, and one of the big things is that it's in the standards that it's 28 days for vials of insulin, and I know sometimes that comes up, and so it's helpful to have it to be a part of the standards. Oh, yes, and that both Humalog and Novolog are interchangeable. You know, sometimes the doctor will order one, but then the insurance will dictate that they need another one, and so that's why we put that in there as well. and also clearly that it needs to be the parent talking with the nurse to make any kind of changes, not the unlicensed personnel. And moving on to the insulin management with pumps, we wanted to make sure that all the features of the pump are being used, so some safety features in the pump, and we want to make sure that they are operational when they're in a out-of-home setting. The threshold suspend pump is the newest pump that Medtronic has come out with. It is used with a sensor, and basically what happens with it is if a child reaches the threshold, which is generally 60 milligrams, if action isn't taken and the alarms continue to go off, it will suspend the pump until it has been restarted, until it has been addressed and restarted. So we are working on a skills checklist for this, as well as a health care plan. Self-care management, the doctors really mentioned that they felt like the school nurses and parents could address this best. And so in most cases, the doctor will indicate that the school nurse and parent can determine self-care management needs, and unless they indicate otherwise. And this is very useful, especially as a child is transitioning into self-care. That can be very useful. We're going to address questions at the end. Just a little bit about the website. This is the first page of it, and the pictures actually rotate, so you'll go through different pictures. You'll notice on the left-hand side that we have different sections. We have a section for state guidelines, our school nurse toolkit, a family toolkit, providers, teachers, the Safe at School program, a little bit about 504 plans, and then in the news is just anything new that's coming out. Up at top, you will see where we have a section for the diabetes resource nurses, parent advocates, a little bit about our partners that we work with, including Children's Hospital, Barbara Davis Center, American Diabetes Association, Department of Education. The state guidelines list out, I've already mentioned, we have a general guiding principles, and this is for all children with a chronic health condition. We have our standards that I mentioned to you. There are also guidelines for insulin management, and these are more technical questions that are addressed, and also they are being updated this summer, so keep your eyes out for any updates in this area. In the school nurse toolkit, we have the nurse files where you'll find the care plans. Under training and delegation will be information forms to support the training and delegation, as well as tools for teaching. School handouts, just what they are, and additional resources, links to additional resources for you. So in getting started, this nurse intake form, and again, this almost everything can be used in the out-of-home setting and for the child health consultant. There's a checklist that gives sort of a timeline of what needs to be done. If you need access to orders to give to parents, they are in here as well. The in-depth actions for school nurse is the National Diabetes Education Program, and this is a whole program that has been developed with many partners, including the National Association of School Nurses, NIH was on it, the American Academy of Pediatrics, American Diabetes Association, just the list goes on and on. But the actions for school nurses are also a real good reference for what are guiding principles for the school nurse. So under the IHP, we chose to do a healthcare plan that had a main IHP that gave you general guidelines for that individual student. When do they need to be tested? What is their self-care abilities? What kind of equipment do they have for them? And any kind of special needs that they may have. And then from that point going on into addendums that would address the child's individual needs. Every child, with that being said, every child needs an emergency action plan. And that's treating those hypo and hyperglycemia. But after that, the addendums are specific. If a child is on insulin injections, then they'd use 100B. If they're type 2 and they are only on medications, oral medications, then they'd again use 100B. But if they're on an insulin pump, they'd use 100C. And not have 100B. So it's you have to pick and choose what does the child need. And then, like I said, we are coming up with the insulin threshold suspend pump addendum this summer. If the child has a continuing glucose monitor, you could have an addendum that addresses that. If supplies are an issue, or if a parent is new, if the parent and child are new to diabetes, then it's worth going through the supplies addendum and just addressing here's what we're going to need at school, and again, it is optional. The daily classroom daily care is again another one that is would be good for all children to have. For their classroom teachers. It's a one-page, it addresses hypo and hyperglycemia. It also addresses learning needs that they may have in the school. So this could be good for your preschoolers that you have in your programs and if you have kindergarten as well. More additional health care plans that we've tried to provide are, again, with that classroom daily care, it's to be used with either the hypoglycemia and hyperglycemia flow sheet, or there is another hands. It's actually the number 720. It's the hands up and down. It could be used with that as well. The 400 series are for children that are independent, and I imagine rarely you would have that in your programs, but it is available there. There's a carb calculation worksheet, reporting forms, if you need to have report blood glucose concerns to the Barbara Davis Center. So a lot of different information out there. I'm going to hand this over to Pam. She's going to be talking about training and delegation of the diabetes care task.
Thank you, Leah, and good afternoon, everybody. I'm really happy to be here also. I want to share with you a little bit about my most recent experience with a child with diabetes. It was a 3-year-old who unfortunately didn't get picked up right away by the medical community that it was diabetes and not an ear infection that was bothering her. So she ended up being quite ill, and we had plenty of time, which is kind of unusual in most of my child care experiences, but we had plenty of time to train and delegate the staff as well as develop the care plan. So if you think back through some of the care plans that Leah described, she had 100A because she was on shots, and then she had a classroom care plan, and I can't remember without going back what that particular one is. But then we moved on to, while the health care plan was in process and we were waiting for her to be ready to come back to program, I started in on the training and delegation piece. And we have a marvelous set, very comprehensive set of tools for you to document and train according to the Colorado Nurse Practice Act. The first one I would point out to you is a tiered training instructor guide, and that was developed based on the nationally recommended NDEP guidelines that Leah mentioned earlier. We spelled it out so you have training guidelines using each of the features that are available on the website, on the resource, the collaborative website. We have a diabetes skills checklist for you to document the training that's been provided. We also have a delegation authorization and supervision record. And I know that a lot of the child care health consultants that I've spoken with have, this seems to be their biggest struggle, is how do you document that you've delegated to unlicensed staff the task of diabetes care, and then following up with how do you supervise once you've delegated. So we have that coupled with the diabetes support staff information, and that's just a sheet that takes text directly out of the Colorado Nurse Practice Act, so you can assure yourself that you are very much following what the Nurse Practice Act says around diabetes delegation care. And we have a couple of other documents that talk about how to document your delegation decision. And then we have the tiered training staff documentation for teachers based on an individual or based on multiple kids with diabetes. So this is, as we mentioned earlier, the nationally recognized tiered training. At the lower left-hand corner, you can see the Tier 1. And what we recommend is that all staff in the center or the program receive this Tier 1 training because it covers the overview of diabetes, the difference between type 1 and type 2, and basic emergency precautions. Then the second tier of training goes into a little more depth and really focuses on the child's individualized health care plan, as well as what the classroom teacher and the staff that work most closely with the student need to know about, or the student or child know about managing that child with diabetes in the child care setting. And then the third tier is the really in-depth, how do you take care of the child, how do you do the blood glucose monitoring, how do you administer insulin. It's very detailed step-by-step with each task that you might want for caring for a child with diabetes. This is the diabetes support staff information that I referenced earlier that we took directly out of the Nurse Practice Act, and I know that sometimes when doing training I would encounter staff who were really concerned about, is this legal for me to be doing this, because you're sure teaching me a lot of complex stuff. And I found it was helpful and reassuring to have that kind of information as part of the training. So we have that sheet there, and it's highlighted in yellow there. It talks about supervision, and I know that one of the things that I've encountered with working with child care directors is the amount of time it takes to supervise. I might be able to train 2 or 3 people, or even as many as 5 people at one time, but then I also need to go back and supervise and make sure that the staff that are compelled to do each individual task are doing it correctly and don't have any further questions, and that the child is tolerating it okay. So this is one of the pieces that I mentioned earlier that I've noticed that nurses seem to have the most struggle with, is how do you supervise once you've delegated to them? What does supervision mean? And I can imagine that for directors who are also encouraged or discouraged by the amount of care that it takes for the child care health consultant to provide safe care for a child with diabetes, it's really helpful to know exactly what we're looking for with the supervision. So this document was based directly on the Colorado Nurse Practice Act. And if you go through and you check each one of those little boxes with acceptable performance, then you've done your due diligence. We tried to make it easy and straightforward and very simple. So the skills training checklist, and Leah had mentioned those earlier also, that there's a couple in process. But each one of these skills checklists goes back through each task, like, for example, blood glucose monitoring. It goes through step by step from washing your hands to bringing the child to you, to poking the finger, and then what do you do with the blood, and the little strip and the meter and the number. So you have those step-by-step instructions for each one of the diabetes care tasks listed. Here's an example of that using the blood glucose monitoring. And it always talks about following the IHP, or in this case it says the ISHP, but we're looking at the Individualized Student Health Plan or Child Care Plan to figure out exactly what is specific to that child's care. And then the training resources, and I like this because it's something that I can direct staff to when they're first finding out about a child that has been recently diagnosed with diabetes, or they're enrolling a child and they've not had any experience with diabetes. And that is the 13-module training curriculum that the American Diabetes Association has. It's diabetes care tasks at school, what key personnel need to know, and there is a PowerPoint for each module as well as a companion video. And I think the longest video module is about 7 minutes, but those are all available by web links, and you can also access those web links available on the collaborative website. So the NDEP school guide has a primer section in it. It's about 26 pages long, but it's a very comprehensive guide. It's embedded in this big guide that you see on the screen there. And I highly recommend, in fact, I require all of the programs that I work with have a copy of this on site so that they can quickly refer to it. It's a pretty basic thing, but it also has some very detailed role descriptions of what the parent's responsibility is, what the child's responsibility is if you're working with school-age children, and then a list of the resources that you might want to need for training. And again, I mentioned that the tiered training that we developed through the collaborative also refers heavily to this guide. So MyChart at Barbara Davis Center is an online access. It is originally designed for parents to gather, but what it does is it provides parents and families access to the electronic medical record, where the healthcare provider is documenting all of their orders, which is why diabetes resource nurses are really excited about that. We are looking forward to, it's not completely smoothed out, ready to go just yet, but there are some nurses who've reported having some positive experiences with directing families to the MyChart e-brochure and contacting through the Barbara Davis Center, the number there on the screen, to get signed up for MyChart. And we're hoping that in the very near future that the diabetes resource nurses will be able to access those quickly and easily, those records that are sometimes elusive and difficult to access. We're moving forward in the technological world. So there's some additional resources for school and child care health consultants. There's a guidelines for insulin management by school staff, and that's also available on the website. And I would really encourage both child care staff who've been delegated as well as the nurse or the child health consultant who is delegating to be very familiar with this document. It really talks about the specifics of administering insulin, and I know that in my experience as a resource nurse, that has been the biggest question for child care health consultants is how do I safely delegate insulin? And so I think this should be in the nurse's printed out, ready to go toolkit. And then Leah also explained the I want to call it the position statement, but the standards. And I would strongly encourage you to also have a copy of the standards with you and ready to refer to. This slide particularly mentions the position statement, and the position statement was written in 2012, where we had a little bit of time, we meaning the collaborative had a little bit of time to really set forth a position statement, and it's pretty long, but I would direct you back towards the standards and have those available and ready and easy to refer to when you have questions come up. So what's new, and I kind of wished we should have kept Leah on the phone here because she's really thick in this. The continuous glucose monitors are new, and they're a huge benefit to children who are newly diagnosed, especially for young children who might not be aware of what their glucose is trending like. So they have a little tiny sensor that goes into the subcutaneous tissue, and it's usually a real flexible catheter. They can remain into place up to 3 days, and I've heard some parents boast that theirs have been in 10 days and longer and still working well. And they should not be calibrated more than 3 times daily. And the calibration is where I think the child care staff and the nurse and the family can kind of get at odds. Is the calibration needs to be done 3 times a day, and it requires a blood glucose test. The really cool thing about glucose monitors is it can tell you trends. It cannot tell you exactly how to treat insulin or hypoglycemia at any given time. So if you've got hyperglycemia, hypoglycemia, you must use a finger poke to treat. And the insulin management, and again, this is just kind of reviewing what Leah mentioned earlier. The fast-acting insulins are interchangeable. Humalog, Novolog, and Apidra are all interchangeable. So if you see orders for Novolog and the child is bringing in Humalog, you know that that's okay, unless the child is allergic to a certain brand or otherwise indicated. But again, the insurance companies generally have one particular formulary that they cling to, and that's generally how it's dispensed or prescribed. And in the school setting, as it should be in the child care setting or the day camp setting, if we're looking at the summer programs, fast-acting insulin is usually given 5 to 15 minutes prior to lunchtime, and you want to be very careful about using kids or administering kids insulin and then sending them out to play for longer than that period of time before going to lunch. And then the 2-digit rule for giving insulin is a kind of a folksy type of way of figuring out insulin, and I don't want to go into detail on it because it's not appropriate for the school or child care setting. So the self-care management, this is something that's fairly new, is all students, regardless of age or expertise, require a plan, and they may need assistance with hypoglycemia and illness. So they need to have, at bare minimum, an emergency action plan. And I know most of this audience is dealing with, at the very most, school-age children, but they do need to have an emergency plan even if they are totally independent. So the emergencies that could require a plan, definitely they're not going to be able to perform self-care. So the standards are in the process of being updated, and I thank Leah every time I see her for her efforts because it's not an easy job to get all of the people together and on the same page, much less in agreement of what we're doing or what we need to be doing for the standards of care. The IHPs are being updated on a regular basis as we find glitches, as we find unnecessary phrases, they're being updated. So before you go and develop another individualized health plan, I would urge you to check the website and make sure that you do have the latest and greatest one. And check the website frequently. You never know what might show up there. So in May of 2014, Leah Wyckoff and Kathy Patrick, on behalf of the Diabetes Collaborative, surveyed school nurses as well as diabetes care providers. And they had a pretty good turnout or response rate on who was using the standards, which I think is awesome. Is a little over 90% were using, of the school nurses were using the standards to guide their practice, and 100% of the providers that responded were using the standards. And this is just a breakdown of what ways the standards of care have been helpful to them in their future. And I want to draw your attention to the largest piece of the pie, which was the 16%, which is the working with the healthcare provider. And I know that it's been really helpful for me in my practice to be able to point back to the standards of care when dialoguing with a healthcare provider, saying, you know, this is what we all agreed on. Can we go back to working under this particular agreement? 14% is a delegation and training. So I think that was also really telling too, that 14% found the delegation and training really helpful, and working with parent and guardians of a student with diabetes really helpful. So I would just really encourage you to study this chart as to what you can find to benefit and strengthen your own practice. So this is a picture of the diabetes resource nurses that gathered in February of 2015. February of 2015. And you can see most of us there. I wasn't there that day, but we're a friendly bit of people, and we're very eager to help you. So all you need to do, if you are looking for some technical assistance, is go to the website and look for your region or area and contact the nurse, the diabetes resource nurse there. So we are discouraging school and child care staff from calling the Barbara Davis Center or other healthcare providers. Those kind of communications should be made by the school nurse and the child care health consultants. They shouldn't be made by delegated staff. So now we have opportunity for questions or comments. And if you could use your chat box. I think we've resolved all the audio questions. They've been resolved. Heather's nodding yes, we're good to go. So go ahead and type in your questions, your comments into the chat box, and we will answer them to the best of our abilities. So thank you so much for this webinar. Thank you, Kara. Could you provide the link to the website that you are referencing? Perhaps you did it at the beginning, but I was a minute late. Well, Kara, I'm happy to tell you that it's very easy. It's probably the longest website in Colorado. It's www.coloradokidswithdiabetes, all spelled out, .org. Thanks for asking. I'll just give it a couple more minutes in case there's some questions that come to mind. Teresa Rapstein is asking if we'll get a certificate for this training. Thank you, Teresa. Yes, in 10 working days you can look for a certificate. You will receive the certificate of attendance. By email? By email. So the email address that you use to register for the webinar is where you'll receive your certificate. Good question, Teresa. Teresa is also prompting a lot of extra information. She said the webinar will be posted on Qualistar for future reference. So, thank you very much. Oh, okay, we do have a question. From Susan, what if parents want different guidelines than healthcare provider orders? And she gives us an example. The provider order says to call parent if glucose is greater than 300, but parent says to call if greater than 350. I'm turning to Leah, and she's giving me a puzzled look.
Well, it's just a complicated,
Do you want to take?
Well, it can be very individual. I think that the biggest thing to make sure that happens is that when it's greater than 300 twice in a row, that means at noon if they're greater than 300, then you recheck them at 2:30, 3 o'clock, they're still high. That would be twice in a row that you check for ketones. And to me, that's the most important thing. If a child is between 300 and 350 and not having any symptoms, then I think it would be fine to wait till 350. But then you've got to get the orders to match from the doctor to make sure he's okay with 350. So that's the biggest thing, is you've got to have that the orders match your care plan. And so the parent, if they could ask the doctor and get that new orders that said 350 on there.
So I'd like to thank everyone today. Are there any final questions? We're taking last-minute final questions for our webinar. Okay. I don't see any. So I'd like to thank everyone for joining us today, and especially Pam and Leah for taking the time to share their expertise and miss their lunch this afternoon, so thank you. Again, this webinar will be posted on our website at qualistar.org. And I know that we just covered a lot of information, so you may want to review this webinar and listen to it again. So in its entirety, it will be posted. Again, please allow up to 10 business days to receive your certificate via the email that you registered to this webinar by. And if you have any further questions, please do not hesitate to call or email Leah, Pam, or Teresa. Their information is on this final slide here. We have their phone numbers and email addresses. And then if you have detailed information or detailed questions about diabetes, we'd like to promote the Diabetes Resource Nurses. And thank you all again for joining us, and we hope you have a great day.